This is Local 4 News This Morning.
All right, welcome back, everybody. In the studio this morning, we have Joseph Appler. He is a qualified mental health professional at Unitypoint Health Robert Young Center, and he's here to talk to us about Valentine's Day, but not just Valentine's Day, not the flowers, the candy, all that kind of stuff, but sometimes it's just, you know, how do you feel about yourself going into Valentine's Day? Sometimes that self-care is something we want to talk to you a little bit about this morning.
Yeah, self-care is incredibly important for individuals to engage in. You know, we oftentimes during Valentine's Day think of loving ourselves, or like loving other people, you know, our significant others, families, friends.
And there's a lot of pressure with that, man.
Yeah, there is.
You know, and sometimes that pulls people into that, you know, so that self-care, that sort of, it's okay, doesn't have to be perfect, right?
Yeah, exactly. And so sometimes when we talk about self-care, we want to stop and go, what is it that we can do for ourselves? We sometimes want to think about self-care as selfish or whatever, but really it's about being compassionate towards ourselves. You know, we would help out a friend if they were in need. We would help out a loved one if they were needing someone to talk to. Sometimes self-love is just as important. Sometimes we need to know that we're our best friend, or to do something for ourselves that helps us feel better or feel like we matter.
And there's some different ways to do this, right? Some people it's meditation. For some people it's exercise. What do you give in terms of advice for that?
Exercise, meditation are super great options. Sometimes even just if you are a person who really likes to be around family and friends, and that's your way of kind of feeling safe, feeling comfortable, reach out to family and friends. For those of you who maybe family and friends is a harsh word sometimes, you know, focus on things like exercise, reading a book, meditation. If you want to sit and, you know, binge your new favorite show, whatever. Doing something that takes just even like in 30, 40 minutes just for yourself to kind of just do what you want to do.
All right, let's wrap this back to Valentine's Day for a minute, because sometimes this is one of those holidays that they kind of put out there that sometimes get people really, really tense. Yeah. What's your advice for that?
With Valentine's Day, it's really about taking a moment and deciding, okay, if you're by yourself, if you don't have that significant other, that Valentine, reach out to family and friends, reach out to people that you can talk to, have a conversation with. Focus on doing something for yourself too. So maybe, you know, we have that Valentine's Day dinner that everyone goes out with that, you know, has a couple. But sometimes it's nice to go do something for yourself. You know, make yourself a steak, cook yourself a meal if you're a good cook.
Right. Okay. So, what about just watching out if you know somebody that might kind of get the blues this time of year? What are some things we should watch for?
One of the things I always recommend to people is if there's someone in your life that you're concerned about, someone that you feel might need an ear to listen to, feel free to reach out. Feel free to talk to them. Try to touch base with them. Ask them how.
Is there a best way to approach them? Because sometimes that again gets into that. We're so sometimes I think afraid to have a conversation with somebody anymore because we text so much and we all these other ways to communicate now. Yeah.
Well, I like to joke with a lot of my clients that really with mental health, it's about having a conversation. And so sometimes just even asking that simple question of how are we doing? What's been going on? Like how do we feel, or how are we feeling right now? I know I tell every one of my clients that the first question I'm going to ask you every single time is, how have you been since I saw you last? And I can tell you that 9 times out of 10, they're going to tell me fine, okay, or it's been all right.
You are lying to me a little bit here.
Yeah. And so I always like, let's expand upon that. And so that's really how we start that conversation, is those simple, you know, small talk questions, but then delving into them and actually listening to.
All right, for people that are interested in resources, tell us a little bit about what's out there for them.
So with the Robert Young Center, we offer services on both sides of the river, Iowa and Illinois. I personally am based out of our Muscatine office, so I made a little drive over here this morning.
How was your drive?
Oh, rainy and a little bit dangerous at times. But no, it really, we offer inpatient, we offer partial hospitalization, we offer substance abuse treatment, outpatient services, that's where I focus in. And then we also have crisis hotlines too, that if you're ever feeling like we're kind of at that point where we really need to touch base with someone, please reach out.
Please reach out. It's too important not to do that. All right. Joseph Appler is a qualified mental health professional at Unitypoint Health Robert Young Center, and we thank you for coming in to hang out with us on a kind of a yucky morning to drive. You can find out more about information about his organization there, right there. It's on your screen, but we've also got that information for you on ourquadcities.com.